This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Meeting agenda, are there any changes or comments? We can move on to public. Public comments. Each person will be given 3 minutes. Please come to the floor there. Okay. And state your name and address, and let's hear from you. We will not respond, so we can't answer any questions.
Thank you for having me. My name is Blair Shalowski. I live at 4015W Lake Loretta Lane, Loretta, Wisconsin. I'm here as a concerned citizen for our community in Loretta Draper. We have a blighted property. I've written Julia, my husband and I have written Julia Lyons a letter. As homeowners in Loretta, we have observed a very concerning issue to us. There are 2 homes involved, one location at 3466 West State Highway 70, and the other at 7023 North 4th Street in Loretta. Both of these locations are owned by Douglas Schoonover. It has become quite apparent to many of the citizens of our community that Mr. Schoonover is a threat to his individual health. He lives in collapsed structures with strong odors coming from the inside of the house. There is trash piled up outside and rats running around the structure. At both locations, he is not only a risk to himself, but also a public health risk, environmental risk, and a fire risk. As a concerned citizen for all who must live near him, we are asking for your assistance to support our community's public health. If you will send someone to inspect the sites, I suggest that there at least be 2 people or a person with the police. He has threatened staff in our town. We understand that this has been brought to the county in the past, and the can continues to get kicked down the road. As a community, we cannot continue to ignore his mental and public health risk to himself and the community. In addition to those risks, he is blighting the area and taking down property values. We hope that you will come and see for yourself how Mr. Schoonover is living and see that there is seriously something wrong with his mental health, and that because of the way he is living, he is causing an environmental and health risk to all of us. And I sent this to Julia and Ron Kinsley and Ron Buckholz, Ed Peters in the town of Draper. And I can't implore you enough for all of you to go by and see these properties. I ran the food pantry in winter for 20 years, and I've seen people like this before. We have to do something before it gets more serious. Thank you for your time.
Good evening. My name is Elizabeth Klein. I'm the clerk in the town of Draper. I sent everyone on the board through Lynn today 6 photographs of the properties that we're talking about. As the town clerk of Draper for the past few years, I have received numerous complaints and concerns about the properties located at 3466W Highway 70 and 7023N 4th Street in Loretta. The citizens who have come to complain do not wish to be named out of concern for their safety, but there are over 20 people who have asked the town to do something about these buildings. My understanding is HHS has to placard the structures as uninhabitable before they can be raised. I have reached out to you and other departments at the county for the past 2, now going on 3 years, for help in addressing the deplorable dwellings that are growing worse as time progresses. We saw progress last fall when the county appeared to begin enforcing the violations of the zoning ordinance, but nothing was done, and now the snow has melted and the situation is not resolved. It is worse. These structures are collapsing and not safe for human occupation. We are concerned for the safety and well-being of the occupant, for his neighbors, and for our community as a whole, as these properties have the potential to invite crime and drugs into our corner of Sawyer County. Neighbors have had to change how they live in their homes and are talking about moving after 3 years of the continuing degradation. Accumulating trash, rats, odors, and possible criminal activity they have observed. The photos I emailed are from yesterday, June 5th. We are asking you to please enforce the zoning ordinance. The town will assist in any way we can to see this situation resolved. We cannot risk the continuing degradation these buildings and occupant pose to health and safety in our community. Thank you.
Hello, my name is Christopher Klein. I'm the Secretary of the Town of Draper Plan Commission. And following up on everything, I agree with everything that they have stated. Our plan for the town is to encourage people to move to our small community. And this resident is having the effect of causing people who have recently moved and also longtime residents to have to move out of our township. And it is a blight. We have a nuisance ordinance that is not being enforced. And it is attracting, these ordinances exist at the county level and at the local level to prevent blight and decay of a community. And what we have is, since this individual moved into the property on 70, he brought in a lot of basically trash and equipment. So he has the ability to bring in all kinds of heavy equipment, machinery, debris, garbage, for stuff for resale, stuff for not for resale. One of the items was a school bus that appeared to have been rented out or occupied by drug abusers. And there were 5-gallon buckets underneath being used as some sort of a facility or storage unit. The other building that I believe is actually being leased to him or some kind of a property transfer deal being worked out there. I was asked to take a tour of that building a couple years ago to have that structure burned down by the fire department as a so-called test burn, which we refused to do because it was too hazardous. So having been trained on hazmat materials, and it had all of the hallmark that you would see in a training materials guide as far as what looks like a meth lab, everything from extremely corroded sinks and toilets and like the stove just corroded beyond belief that you could only achieve with chemicals, battery, what looks like acids, batteries, kitty litter, all the hallmarks of, chemical odors and yellow chemicals. So I know I'm going over, but these, okay, I'm sorry, my 3 minutes are up, but I'm just trying to finish this sentence that these things are really contributing to encouraging drug use in our community. And so that's why there needs to be something done. Thank you. Sorry for long-winded.
How's everybody doing? Steve Beining, Town of Draper Supervisor. So I was recently elected 2 months ago, so now I'm starting to understand how your jobs are, and it's a lot different than what I imagined it being. So I'm going to try and put myself in your position and kind of maybe from a township, what we're dealing with on a monthly basis with the complaints and having to add agenda items and added workload for us that are trying to get a lot of other items off the deck for our workload. And I think the big one for me that comes down is, I have a couple of emails out to HHS and I haven't really gotten the response, and it doesn't look like after a couple of years we're getting the resolution. And as a town board supervisor, I don't really know what to do. It's one of those that really feels out of our wheelhouse and into the purveyance of HHS. And I don't have a lot of experience, and I understand HHS is a really vast umbrella of human services. So I think it comes down to like the mission statement, right? The mission statement for HHS, that I don't remember the gist of it, but I remember the first word, and it's respond. So I guess me as a town supervisor, I'd just like some feedback. It's our community, and I'd like to be able to help. And, after dealing with these items for a couple of years now, I'd just love to get this off the deck. So any help we can provide we'd love to do it and work with you to be able to resolve this issue. Thank you.
Okay, at this time, we are open for listening to any comments on what we would potentially put into our budget for 2024. And it's just something that we open it up every year prior to budget being put into play.
Everybody,
Chairman, can you hear me?
Dawn, we can hear you. Can you
we-
hear us?
Yeah.
No, we were all on mute when the Pledge of Allegiance and everything happened. We did not hear roll call if there was roll call done.
yes,
None of us heard that. It's going in and out.
We can't hear the people at the table at all. Sorry, this is Patty.
I understand that IT is working on this issue. Everyone has their mics on, so we're just gonna ask everybody to lean into your mics, please, or pull them closer.
Okay, so everybody that's on Zoom was put in for roll call as present.
Correct, Ms. Pettit?
Thank you. We didn't hear it. You guys were muted.
you have some comments on the public hearing, Dawn? Mr. Klein?
Chris Rusk has his hand up.
Nope, I'm good. Thank you.
I guess I'd like to make this really simple. I kind of took a peek at the budget numbers. Are we looking at 2024 spend equal at 2023 levels, higher than 2023 levels, or lower than 2023 levels? Oh,
Yeah,
okay.
Yeah, we're not there. It's just kind of things that people would want to see us be able to include in the HHS budget.
Guessing there are a bunch of folks that want to include like some funds for, say, taking care of some properties, right? All right, sorry about that.
Anybody else online? Comment on the budget?
No other hands are up.
Pardon?
No other hands are up.
Thank you. Move on. Consider approval of the minutes from our previous meeting in April, May, I'm sorry. This is June. Everybody's had a chance to read them, I assume, so can I get a motion to accept?
Motion to accept, Carol.
Do we have a motion to accept?
Second.
Second. Any comment? So everybody in favor, say aye.
Aye.
Okay. Anybody nay, say no signs. Okay, thank you. Committee reports, LCO liaison. She's not present, okay. Administration. Wait. We have, is Joey?
No, I don't think Joey has a report.
Then
The only thing she had to report was that her contracts were now coming into effect and things were moving forward for the senior center.
the only thing I know that was happening, which was a good thing, was the money we were supposed to receive last September finally gets here in June.
I can't hear the chair at all. Maybe I'm the only one.
You may have,
I can't hear anything either. It's really very quiet.
No, that's about as far as the board's going. Okay, can people hear me now?
Yep.
Yes,
Does somebody have anything they want me to repeat? Oh, the senior center, the money that it is supposed to receive in September of every year is finally getting here this year. So that's a good thing, I guess. But we can move on then to administration.
Did you want to start or do you want me to start? Okay, we have included the services list as we typically do in the administrative report, and Kay, especially for you, that'll help as you're new to know what services each of the departments have. The other thing is actually today we had new director orientation for the state. And so there were some that had been in there almost a year, and I've been in a month, so I got to get orientation early, so that was good. Also have been meeting with each of the supervisors, and we will be starting to look at, we've got regular meetings scheduled bi-weekly, hoping to be able to build in some strategy, looking forward and prepping for the budget as we move forward. The other thing is that we're looking at our space as well, and trying to pull all our employees in so that we're kind of reconnecting and moving forward as a team. So kind of that's overall. I'll talk a little bit on each area as we go through there. Andy, did you have some other pieces that you wanted to add in?
I think I'll just add them as we go down.
As we go along?
Yeah.
Yeah, okay. Do you want me to keep going down? Are we going to move on to adult long-term care?
Guys have the floor.
Okay. Okay. And as we move into adult long-term care, let me just get my pages together here. Sarah Sebecki is our supervisor for adult long-term care unit. She has moved recently, which is in the report. But she's helping to support us remotely until we're able to hire in a new supervisor or she finds a new job. So she needed to move out of the area for her family. So in the meantime, I've been trying to help support and be over at the new facility. We're getting really busy with disability with ADRC. That's been pretty active. We've been lucky enough to be able to hire our information and assistance position, which will really help. That team was, and that is when they're kind of coming in, we're giving them information, we can work on assessments, get people hooked up on the resources that they need. So we're moving forward with that. Gerard started about a month ago, maybe not quite that long ago, half-time. We're sharing him with Iron County. So he's just getting to know the area. And for the dementia care services, we are having a training that is going to be called Grandpa and Lucy Performance on June 18th. That's going to be all across the region. It would be a really good thing to be able to go to if you're able to. And that is really talking about dementia as a granddaughter to a grandparent perspective and looking at what's happening and how best to support the families. APS, definitely getting out there, doing some training with the banks on financial issues and exploitation that's happening. We also included a recap of what we've been seeing for the APS cases for the year. So they're definitely keeping busy. And one of the things that the supervisor does do is help support APS half-time. So when she goes, that'll kind of put a little bit more pressure on Rose as we move forward. So hoping we can get that position filled. Any questions on adult long-term care? Anything up there? We're good. Okay, thank you. Okay, moving on to behavioral health. we're pretty much status quo. Things are looking really good in CLTS. That is one area that continues to grow. We're getting more referrals. So that's the Children's Long-Term Care Support Waiver. What's nice about that program is that has a good funding stream with the state. So even though we're getting a lot of referrals in there, it is financially supported. So that is something that doesn't take a toll on our budget as we move forward. We'll continue to work and look at the comprehensive community specialist program as we move forward. I know we've been looking for a therapist, and Alicia and I met and have had conversations about that over the last couple of weeks. And then also in there is our mental health cost by client report, is our typical report that's in here. And really no variances out there at this time. Any questions on behavioral health? I don't think Alicia was on, was she? Okay.
I'm on, Julia.
Oh, okay, do you have anything you wanted to add? I'm sorry. Can't see ya.
No, just the need for another clinician, as we have spoke today to one of our contracted. Can you see me now? My computer hasn't been working right all day. It doesn't matter if you can or not.
We can hear you, so that's good.
Okay. But we had a one of our contracted providers for CCS. She informed me that she this last client that she's got, this will be her last one, and she soon. So that really limits us to one other provider through Carol Lund as far as a mental health professional. So that's limiting our growth for CCS. We really need to get a mental health clinician in there. And we do have, or well, we had a potential client back in February, but there has been nothing set up for an interview, which I would really like to get moving on if that person has not already taken a job elsewhere. But in order for us to be able to expand these programs, we need more clinicians than just Joe and myself.
Thank you, Alicia.
Sure.
And then Joe, I see you're on. Did you have any additional you wanted to add on the mental health cost by client report?
No, I just want to say that we have some high cost cases coming. We have 2 potential placements that I think might cost quite a bit. So we just have to continue to look for different strategies to deal with these individuals, but we have 2 chronically mentally ill individuals that are, in high cost placements that may need more services.
Thank you, Joe. Anybody have any questions? Carol?
Joe or Alicia, this is Carol Pearson. Why the delay for the interviews for the mental health commissioner? What's the delay for the not having the interviews done?
I can't answer that. I don't make that decision.
Right. That's a decision we made in administration to wait until we had a new director in place to decide
Oh, okay, thank you.
what we're going to do with the program.
Any other questions on behavioral health? Thank you, Joe and Alicia. Child Protective Services, this is an area where we've been spending quite a bit of time. We are starting to make some good progress. Erica Prince, who was our family aide, has been promoted into caseworker position. So her position is now open. And we do have, it does look like we have some interest in that. We also recently hired Missy McKinney, I can never pronounce her last name correctly. And she'll be our kinship foster coordinator along with a caseworker. And I had mentioned last month that we had hired Paisa Marlowe as well. So we've got those areas filled up. We're have a potential out on the youth justice area, which will also be a connection with caseworker. and maybe some leads on a supervisor. So once we get the supervisor position and the family aid, we will have full staffing. So that will feel really good. Been working very closely with the state on getting the orientation process set up. It's typically a 6-month orientation process, but because we were so short-staffed, we have found a way that we're able to accelerate that with mentorships. So we're able to work with some number of other counties who are helping to offer those mentors and shadowing opportunities for us. So hoping that that team continues to feel supported as we move forward. The other thing that is in there is that we did put into the agenda is the children in that are in care expense report. That is not over and above where we expect it to be for the budget. So that is looking good as well. Amy, did you want to add anything else with CPS? Okay. Any questions? Okay. Youth Justice, we have that report in here as well. Sarah has been really helping to assist us in being our kind of boots on the ground here for casework on CPS side, as well as doing youth justice. We've got a number of things in place here. One of the things that we do know is that our placement costs are higher with the youth justice than we had anticipated for budget. So we'll be wanting to watch that closely, and we'll be giving you more information as things clear up and kind of see where we're going for the year. Any questions on that? Okay. Economic support is next, and Shauna, you can just give updates related to your report. I think it might be on. Is the mic on for Shauna? Okay.
Test. Okay, so the report is as follows. Food share cases have remained pretty consistent, as well as Badger Care. Starting this month, we are doing Badger Care renewals, and so, well, all Medicaid renewals. So we have seen a significant uptick in our calls. Last week, starting Thursday, we were pretty overwhelmed with calls. We had calls as long as 40 minutes hold time. So just doing our best to support staff as we get back to this level of busyness. Also, with the public health emergency unwinding, 2 of the policies that have come into effect starting this month is the student eligibility. So they received an exemption. So this is for college students. They were able to be eligible for food stamps if they were a part of work study programs, or if for financial aid, their families had a 0 contribution, they would be eligible for food stamps. Typically, students that are in a 4-year program are not eligible for food stamps. During the COVID public health emergency, they were exempted and they were found eligible. That is ending this month. Another program that is being put back in place is drug testing for persons convicted of drug felonies within the past 5 years. So this starts next week, June 12th. So any applications, food share applications received June 12th or after will be subject to drug testing if they've had a drug felony within the past 5 years. And then any case that comes up for renewal. You know, again, that was given an exemption over the past 3 years. They had to agree to a test, but we weren't doing the testing during that time. So I've worked with Julia. We're going to be administering those tests to start with through public health, and there'll be an oral swab that we'll be sending out. Really, to be honest with you, it's not a lot of our cases But if they have had a drug felony within the past 5 years, we will be doing those tests again. So again, a lot of changes for economic support. You know, we've done pretty good here in Sawyer County staff. I mean, I've got one staff that's coming up on 30 years with the county, and it's a pretty solid unit. We work well together as a team and just hoping to continue to be able to support them. So, thank you.
Question, please. For the drug testing,
Yep.
is there a fee associated for them?
There's not a fee for them. We are responsible for the fee. Economic support programs are.
And how much is that cost, do you know?
What's that? It's covered by the economic support program. So we are sending those tests out. I believe they're $25 per test. So the other thing with that I'd like to add is that if they are on probation or parole, which most drug felons are, we can reach out to probation and parole. And if they've had a drug test within the last 30 days, we can use that. It's my plan to reach out to them and ask them if they're willing to do the drug screening for us. So I'm hoping that that takes care of a lot of these tests as well.
Okay, I have a question too.
Sure.
On these swabs, say you send them out
Correct.
to people's homes and they are expected to wear.
So this would be an appointment made with public health nurses where they would come in and the nurse would take the collection and then it gets sent out to a laboratory. Yeah, it's a good question.
In other words, if for food stamps and so forth, if they don't pass this test, are there consequences?
They would not be eligible for food stamps.
Okay, thank you. Any other comments?
For how long?
It's a 12-month,
They would lose it for 12 months then?
correct.
That's significant. And so with that, I know that that was brought up by Lorraine too last week or last month. And, oh, you've got,
It takes a while to get noticed that there is a hand up when she is finished.
Okay. Thank you.
oh, okay. And so, we'll be in that loop and be able to help connect people to resources, hopefully related if they want to seek treatment for drug addiction and that type of thing. We want to make sure that we do have that connection there, as well as being able to, and we've already put this together, how to get food from the food pantries and all the other available resources that we have in the area.
Okay, I understand somebody online wishes to speak.
Ms. Pettit, can you answer your question?
Yeah, Mr. Russ, can you mute your mic? That's my first. Second of, my question was it's the 12 months waiting period, correct? If they get booted off for 12 months, if they're found positive. What happens with individuals that have young children? We all know that there is a drug and alcohol issue going on, and we have the suicides within the community once again. Well, it's still ongoing. It hasn't ever stopped. So you're now going to pull food stamps for these individuals. You don't think that it's going to push even more people over the edge?
So the member who has the drug felony is disqualified from receiving. If they have a household, a family, the children would not be subject to the sanction. So the household may still be eligible for food stamps, but the person with the drug felony would not be eligible to receive benefits. So if we had a household of 5, let's just say hypothetically a dad and his 4 children, and he failed his drug screen, those children would still be eligible for benefits.
Shauna, follow up. But if he's the only adult, like some of the households within our community, if he is the only living adult because mom maybe OD'd on drugs or committed suicide, how are those children going to collect benefits if another individual family member does not step up to the plate with the reservation?
So the dad would still be the primary person on the case. That food stamp card would be issued to him, and those benefits would still be available for those kids. Now, again, I can tell you this is not normally what I see, but it could be this type of case, but it's not what I see on the average. Most of our drug felony cases, not all of them, but most of them are single households. But I hope that makes sense to you, Don. Just like if I have an intentional program violation against somebody, if they violate the food share rules, they may receive the 12-month sanction, but the spouse and the children would still be eligible for benefits. It's just the person that received the disqualification.
Thank you for the clarification.
Yep.
Okay, any more comments, questions?
Thank you, Shauna.
Yes, thank you.
Okay,
Yeah,
public health.
Yeah.
Julia is here. She'll be able to give the update.
Good evening. I think you have the public health report available for you. It was attached to the minutes today or the agenda. I just wanted to highlight a few things. One, we have position openings for a recovery coach with the AmeriCorps program, as well as a public health assistant. Narcan Direct is still seeing increased interest. We have trained 141 individuals as of the time of the report and distributed 56 boxes of Narcan, which is 2 doses in a box. A number of our staff have participated in trainings and conferences recently to maintain our capabilities. This includes Under One Roof Preparedness Conference, a critical incident stress debriefing, and as well as the opioid summit. Are there any questions? Okay, thank you.
I have a request. Could I get a copy of what you sent out today? My tablet is not working.
Oh, sure. And it's posted right there, but
No, just what you just went over.
sure. And that's in the report, so I can most definitely do that. Yep. Thank you. No questions? No other questions?
No, fiscal. Are you more in public health? Fiscal.
Patty, are you on?
I am on. Did you have specific questions? I can barely hear anybody. This is 4 months into the year, so it's a little early, but we are, as you heard earlier, starting on the 2024 budget process and looking at our expenses year to date.
Yeah, it's still, what she's saying is she's having a hard time hearing, but we're 4 months in. A lot of the billing cycles just started to kick in, like the bills from the outside providers are usually a few months behind. So there's a preliminary, I shouldn't say preliminary, but budget is in here through 23. Although I would say it's probably not showing you a whole lot of useful information yet. And even with that though, like we did a little while ago, we've already started the 24 process through the public hearing on services, and departments will start getting their budget instructions this week from administration.
Is that it for fiscal now?
Yeah, and I'll walk out on the limb for Patty and say at this point, what we know, Joe pointed out some potential high cost placements that are coming up. We do have one in the youth justice area that's a little bit higher than normal, but for the most part, we're projecting within the budget at this point, to this point in the year. We don't know the rest of the year, but there's been really no other surprises so far.
Let's keep it that way if we possibly can.
If we have any control, we do try to.
So our budget is 459. Is that what over here, the adopted budget grand total? 459, 171. It's 906, 456 then. I was just wondering what the,
Which page are you on?
oh,
I think you might be looking just at adult long-term care.
okay.
So each, as you go through, you'll see, and Patty, you can kind of speak up too, but you'll see the agent of the state program is, which is the licensing.
Yeah, I
Yep.
got it. I got it.
Okay.
But there's no grand total.
Yeah.
Oh, maybe not. I was thinking that there wasn't. I had in my mind that there was one that was a grand total page. Nope, we've have them separated out by each unit to see where we're at rather than a roll up. And then that you have the purchase service recap report that shows all of the different expenditures that we have versus to budget. And again, that purchase service, a lot of times those are delayed in being able to get the bills in and get that paid out. So
Can you give
Pretty
me
early.
an idea of what the grand total is?
Patty, can you just tell what the grand total is on the overall budget for HHS? I'm so used to looking at.
I heard my name, but I can't hear anything you guys are saying. This is, the purchase service recap, and it is through April, but some of the months only have 3 months worth of expenses to them. Can you guys hear me?
Yeah, you're pretty
Yeah,
tinny.
okay. So, the state mental health institution, we've only got 2 months worth of expenses, and our out-of-home placements for, youth justice and children's services are only 3 months worth of expenses because it's that delayed when we get our bills. But otherwise, the rest of these do have, 4 months worth of expenses. At this point in time, it's not looking horrendous. The only thing that I do want to call your attention to is the youth justice out-of-home placements. That has increased quite a bit with the working of the cases.
And Kay, next time I'll make sure I bring a full, we'll do a full budget
I just
performance
wanted to
recap.
know what
It's
number I'm thinking
yeah,
of.
it's a few $1 million.
Okay.
And
Over
the other
8
thing with
million.
it, yeah, thank you.
Pardon?
Over 8 million.
8 million? Okay.
And to remember that doesn't all come off a county levy. There's funding sources that come in there. There is county levy in there. And I think that might be also what you want to be able to see, and we can show you that.
Online or?
Dawn, could you ask your question?
Yep, I'm looking at the service recap for under AODA and MH. It's $2,000. That's what's budgeted for the month or the year. Because then you got a $30,000. It looks like Northland on call. So is the 32 for the whole year, or is that just a month or every quarter?
I'm sorry, Dawn, what is it you're looking at?
I'm looking at the 2023 HS purchase service recap.
Sure, but which line?
The Northland counseling for $2,000. And then
That's only to pay, that's, okay, so that's, Okay, that's to pay for, that's a yearly expense. And that would only be to pay for somebody who needed counseling sessions, who fall under our jurisdiction to serve them, that we cannot serve in-house, and that do not fall under any of our other program availability. So it's something that we have to have in there. Basically, it's just a placeholder, and we haven't spent any of that yet.
What about the Northland on call for 30 grand?
Northland on call is the that is $30,000 for the year, and that is to pay Northland Counseling to be on call to go out for crisis services. So if Joe gets a call in the middle of the night and they need an in-person visit, he can call Northland Crisis and have them go out and see the people.
Okay, thank you, Patty. I appreciate it.
You bet.
Just I don't have the exact amount, but the HHS budget's about 8.5 million. And it's about half of that comes from county levy or county funds, and the other half comes from state aids.
Are there any other questions from the members? Mr. Banning, did you want to make? Okay, thank you. 18. For future agenda items? Anybody want to see anything in particular?
I have my hand up. It's not future agenda. It's
You have some other comment?
I'm trying to figure out, we have a recovery position that was made. Was that in a conjunction? Did behavioral health have any was there any co-work with behavioral health in having that position become available?
This is Julia. That recovery coach position is part of an AmeriCorps program, and we'll be able to help assist the county with as we move forward with the opioid grant pieces, and be able to assist with the work that's being done with LCO and the prevention network that's going on, and be able to expand even further and work with. It's kind of it is an AmeriCorps volunteer. It's a 1-year program to be able to help get services up and running.
I guess my question would be, was there any input or coordination with the current behavioral health people that are on our staff?
Not yet. We haven't done anything with that position yet. It just
Okay.
got approved we just did the approval through the LCO Sawyer County Prevention Network to be able to get that up and coming. And now we'll need to be able to work with all of the programs as we move forward. It's a county-wide thing.
Okay, thanks, Julia.
That's it. We're adjourned.
Could I just make a quick announcement about the audio? This is a temporary fix, everyone, until October when the final equipment comes in. So it will be up and down. It'll have its glitches until the new audio is in place. Correct, Andy, in October. So if you have any opportunity to come in person, that'd be great. Otherwise, it may still come in and out because this is a rigged up situation at the moment.
Thank you.
Thank you for your
Thank you.
patience, everyone.
You keep this room in. Like 30? Yes. Yeah, it's really cold in here.